Hey everyone, my name is Dr. Mark Burdorf. I'm a board-certified chiropractic neurologist, Scottsdale, Arizona. And today we're going to be talking about a study that just came out in the Journal of Exercise Rehabilitation, April 28, 2020, which I think is really cool. And this has a lot to do with the type of therapy I do in my office. Now, there's 3 different pathways into the brain that affect your balance and actually do control your postural muscles of your neck. And they are your eyes, your inner ear, which is your vestibular system, and in the back of your brain is something called the cerebellum. Now, those 3 pathways control balance and muscle tone. And they did a really cool study. They found 22 perfect people, and I'm sure they had to go through hundreds to find this, but these people were 20 to 23 years of age, and they pre-screened them. They had no visual problems, didn't wear glasses, they didn't wear contacts, they didn't have cataracts because they're pretty young. They checked them for vestibular pathology. They had none of that as well. And then what they also did is check for psychiatric backgrounds. They didn't have any of that. Now, these people had no history of trauma, no history of concussions. They x-rayed them. They had no arthritis. So they were essentially perfect. And what they did is when they measured their x-rays, you always measure the curve of your neck should normally be about 35, 45 degrees in a side view, but there's something called the cranial vertebral angle. And the way they figure that one out is they take a horizontal measure at the C7 vertebrae of your neck and then the tragus of your ear, and that angle should be 50 degrees or greater in a healthy individual. Now, what they did is those 22 people, and half were girls and half were guys, they had half of them as the control group looking at a fixed object in front of them for 40 minutes. And the other half, they had them look at their cell phone looking down for 40 minutes, which meant that cranial vertebral angle was going to be less than 49 degrees. So after that 40-minute session, they retested the control group and they were perfect, and they still were perfect because they were looking straight ahead at an object and there was nothing stressing their body. What they found was the people that were in the experiment group, what happened with them is they still had normal vision, they still had normal vestibular, but there was a marked difference in the muscles of their neck. And what they did is they evaluated that through Doppler ultrasound, and they actually had laser pointers when they had them close their eyes, and they'd have them turn their head each way and then retest, and basically their proprioception, which means your positional awareness, was skewed, and it was actually much more worse on the right side of their necks. So, what does this mean? Are you going to stop using your cell phone? Probably not. In functional neurology, and again, these were 22 perfect people, roughly ages 20 to 23. Well, what happens if you're 30? What happens if you're 40, 50, 60? What if you've been in car accidents? What if you suffered numerous traumas to your spine? What if you have arthritis? Okay? That's damaged. And so in functional neurology, what we do is we find the pathways that work because we got to rehab the broken ones. And that's where a lot of times I may use an eye exercise, I may use vestibular therapies to rehabilitate people that have suffered concussions, whiplashes, and just repetitive stress. So if you find what I'm saying interesting, maybe it's time for you to make an appointment with me and do a consultation, and I can tell you your treatment options. Have a great day.